into our next panelist, Dr. Brenda Paperniak, who is a perinatal mental health specialist. I couldn't have set that up better.
Yeah, I walked right into something. That's a
Thank you
great
so much,
distinction. Yeah.
Dr. Centillion and Dr. McElrath, for talking to our patients today about their most FAQs about MFMs and appointments and the struggles they have in, whether they should see you, when they should see you, how to talk with you. We appreciate it. And I know at least Mark is a competitive, so he's probably going to be following the tracker count to see how many people watched this panel over some of the other panels. So I appreciate both of your times and thank you for all that you do for our organization.
Thank you. Bye now.
Bye. Brenda,
Hello.
how are you?
I'm good. How's it going here?
Good. Thank you so
Good.
much for joining us. Do you have slides?
I do, yes.
Okay, perfect. I
So,
made you co-host, so you should be
okay.
good
To share the
there.
screen. Okay. Let me. mm,
I'm going to do a little intro while you're looking for that.
okay. It says one panelist can share at a time.
You should be the only one.
That can do it. Okay. Because.
You should be the only one sharing at the moment.
Okay. Let me. Hmm. It's not like click or giving me the option to share. Like I'm seeing share screen, but it's not giving me any, like when I click it, it's not letting me do anything.
It doesn't do anything. It doesn't give you, oh, but there is the green share.
I see the green share,
Hmm.
advanced sharing options.
All right. Let's see.
Let me try that. Yeah, it's not.
Let me withdraw the permission and
Okay.
set it up and see if that does
I mean, if it
anything.
comes down to it, I could always email my slides to you.
Okay. I just made you a co-host. You might have to say yes.
Yeah, I don't even see that. But it's not like when I click it, I click next to it. Let me go.
Yeah, mine says multiple panelists can share simultaneously.
Let me just email to you because that way it'll just deal. Would that be easiest probably?
That's fine. Sure.
Okay. Let me just figure out how to do that. But yes, you can go ahead while I share this
Sure.
with or
Sounds
send
good.
it. You can.
Dr. Brenda Piperniak is licensed clinical psychologist and specialist in perinatal mental health. She's been practicing in the field of mental health and medicine for over 25 years, currently in private practice. But for the previous 6 years, she worked at Ascension St. Alexius in Hoffman Estates, Illinois, that's in the Chicago area, working with the Pregnancy and Postpartum Mood and Anxiety Disorder Program. 4 years ago, she began the perinatal health psychology program as an extension of the perinatal specialty services offered at Ascension, Illinois St. Alexius, and to allow for increased support for families on the antepartum and NICU units while mom or baby was hospitalized. Dr. Paperniak has had the opportunity to present at national conferences, contribute to scholarly writings, and provide mentorship in the fields of mental health and medicine. And a couple of side notes to that. She's also one of our own members. She's a HELP and preeclampsia survivor. She had delivered at 36 weeks. And her own experience, her own struggles with postpartum depression and trauma have been major contributors to her passion for this work with new families. She's also one of our go-to folks. She's on our PCORI ambassador board, as well as one of our mental health professionals that we go to when we have questions that are too advanced for us to delve into. So we appreciate all that you do for us and for our members, and we appreciate your chat today. I'm gonna pop into my email here and see if you have.
Do you see it?
I gotta get there first.
Okay.
There we are.
Yeah, it's still not letting me share, so
no problem.
That's okay.
All right, I'm going to, let's see, get these downloaded. Oop, there we go. I'm going to share these with Katie. Would that be okay if I share them with you? Is that a yes? I can't see you.
Yes. Mhm.
Okay, awesome. Thank you.
And I'll go ahead and start talking just because there's so much
Sure.
information. This could be
Yeah.
a whole weekend discussion. And so I'll just kind of, and if I go over something you guys just talked about, then yeah.
No,
Were you
no
going to say
problem.
something, Kara?
No, we
Okay.
after your session is a break, so if you go over a
Yes.
little bit, it's fine. People can
Yeah.
take breaks as they need to, so not a problem.
Absolutely. So, my goals today is just to kind of give some brief overviews of, perinatal mood and anxiety disorders and kind of understanding them, and understanding, some signs and symptoms, just some basics, screening, resources, and what can be useful to understand for how to get support, but also the little bit of impact that our depression, anxiety symptoms can have. I have to give you permission. Let's see. Oh, there you are. Sorry, I can't do all at the same time.
No,
There we
it's
go.
okay.
Did
It's
that
totally
work?
fine.
Did that work, Katie? Hopefully.
We will figure it out.
And I'll talk a little bit about some of the connections between our biological and mental health, because I think this is such a new field in some ways of putting the two together, right? I think mental health and physical health often have been separated for the longest time, but we're starting to have more and more understanding and more research coming out to look at some of the markers and biological implications of our mental health and how it impacts us. So did it work, Katie?
I sent it
Okay.
via email. Maybe if you open it from there, you'll be able to. If not, I'll get in there and
Let me email it another way too. I don't have Katie in my email, so I will.
It's still saying I don't have
Oh, you know
access.
what? I can share it.
Okay.
It let me open it, so I'll do that. Hold on. I have 500 things open, so let me just.
There's never a time that it's not.
Right.
You could
Yeah,
go.
yeah.
Yeah.
Just like move all of the windows. How do I put this in? Oh, slideshow. There we go. I knew there was a spot here. Can you see it?
Okay. Yep. And you can go ahead and go past that one and that. Right to the up. So the biggest, yep. So the biggest thing is, like I started talking about the relationship between physical and mental health. We do know that we're starting to see, especially with depression and anxiety, that medical complications such as preeclampsia can be a symptom or an outcome during pregnancy if we're not treating that. So we're starting to see that the increased risk of pregnancy complications if we're not addressing the mental health piece. Researchers are starting to look at, even though it's been a little bit difficult to show the exact links between the increased risk of preeclampsia and depression and anxiety during pregnancy, they're starting to look at some of the other common links, such as the cardiovascular, the metabolic risks that we can kind of see with depression and preeclampsia. And so that alone suggests that there can be underlying mechanisms that are in both of those conditions that would make sense for them to trigger each other. And that's not going. So sorry. And now everything's gonna freeze. Am I frozen on with you guys?
Nope,
I
you're
am
not frozen here.
Okay.
I can hear
Hopefully
you.
that just stops. Okay. So are you guys hearing that ringing?
Well, I'm hearing you. Yeah.
Okay.
I can hear
You're
you.
not
You can go to the next one.
okay.
So the psychological stress and anxiety, we know can alter our immune system and our neuroendocrine systems, putting in at increased risk for preeclampsia. Stress, because we often focus on depression, right? And we forget that anxiety and stress during pregnancy can have as much, if not more, impact on us during pregnancy and postpartum. So it's important to kind of have a strong sense of that as well, because we know that cortisol levels can be higher when we're more anxious and more stressed, and that can impact us at our cellular level. Pregnant women with depression and anxiety symptoms can be at risk for developing several different things during pregnancy, including preeclampsia, HELLP syndrome, gestational diabetes, a bunch of different adverse outcomes during pregnancy can be impacted by our mental health. Stress during pregnancy can impact multiple generations. So the epigenetics of that is also starting to become a more studied piece of what we're looking at. It can impact fetal growth. It can impact our rates of breastfeeding. If mom is struggling with her own mental health, it can decrease the likelihood of her being successful with breastfeeding. It can impact our families in long term and our infants and children's own mental health long term. So there's a reason we really should be paying attention to that over time. You can go to the next one. So perinatal mental health, there's a bunch of different terminologies. So I'm going to kind of break them down just a little bit. Perinatal mental health kind of refers to the mental health of mom during pregnancy, after pregnancy and delivery, and if there's even a pregnancy loss. And it is a time that, perinatal mental health, most women have unremarkable pregnancies in terms of mental and even physical health. However, there's a significant number of women who will develop perinatal mood and anxiety disorders, whether that's during pregnancy or postpartum. Next one. So I want to mention briefly baby blues, because we do hear about that, and I think that can be a little confusing too. About 60 to 80% of new moms can experience that. So that's a lot of us, and that's a little bit more common and typical. It's in the first 2 weeks following childbirth. Those are kind of thought of as typical and normal. They're usually brief, and they can be triggered by the hormone shifts, the sleep deprivation, the fatigue, and will generally go away on their own. But parents benefit from psychoeducation, because many times I've heard parents say, I had no idea what was happening to me, or dads will kind of mention they had no idea what was happening to their wife when she would just start crying for no reason and then be okay. So providing that psychoeducation kind of helps parents breathe through that time a little bit. Some of the symptoms that we can see with that can be tearfulness, irritability, fatigue, that feeling of uncertainty and feeling a little overwhelmed. But generally, moms kind of feel happy, even if she's crying. It could be she sees a puppy commercial and she starts crying, and then she's okay again. So that's the baby blues. Next. So then we can also see PPD is often what we'll hear, or postpartum depression. And then people get a little bit confused when they're like, well, I'm not feeling depressed. I just worry all the time. Or I have a need to clean all the time. So that's why it's important to kind of understand that the perinatal mood and anxiety disorders, or PMADs, or sometimes you'll hear people say PMADs, can kind of encompass a bunch of different things. So that could include depression or anxiety or OCD or PTSD. And it's not often that in my work that I see mom with just a straight depression or straight anxiety. I often see pieces of a couple different diagnoses that sometimes fit together during pregnancy or afterwards. But we are most often hearing about postpartum depression, and it can be a little bit more than that. Next. 20 to 25% of new moms can experience a significant PMAD. While the term postpartum depression, like I mentioned, is often used, we can see symptoms consistent with other diagnoses. Onset can happen during pregnancy or in the first year postpartum, and it may start during the baby blues or later in the first year. Next. So common symptoms that we can see with depression and anxiety. With depression, obviously the sad mood, tearfulness, feeling overwhelmed. Irritability and rage is kind of one that is really hard for moms to talk about, but is many times one that comes, brings them into my office because they are so uncomfortable with that symptom. Their poor sleep, appetite, their energy is less. They're not feeling that experience of feeling joyful or enjoying being a parent. Their focus, concentration, memory might be off. They're not feeling connected to baby sometimes, feelings of guilt, and even suicidal thoughts. With anxiety, it's that constant worry, the fear, the intrusive thoughts of something happening to their baby or to themselves. They're on high alert. They might be agitated, experience panic and shortness of breath. Again, that poor sleep and appetite. With anxiety in particular, the lack of sleep can be part of what turns on and intensifies anxiety. So the sleep is going to be a key factor when we're looking at anxiety. Next. I do want to talk a little bit more about, in a little bit more in depth with the postpartum post-traumatic stress disorder, partly because so many of us who do experience preeclampsia or other medical complications during pregnancy and or with our birth process, it can be quite traumatic. And so it's important to understand approximately 9% of women might experience a PTSD in relation to their delivery. And it could be because of the medical complications, the unplanned C-sections, early delivery, baby needing to go to the NICU, that feeling of powerlessness and not knowing what is going on or what's happening. And that, as the doctors mentioned, feeling like we could have done something different, but we didn't, and we caused our own medical conditions. Feeling that we don't have good communication or don't have good support from whether it's our family members, our medical teams, that can make it very difficult. Women who've had previous traumas, whether it's a previous trauma at delivery or previous trauma as a child, they're going to be at higher risk for experiencing postpartum PTSD. Some of the symptoms that we can see are they are constantly replaying the memories, the thoughts of the event that occurred and what happened. They can't turn off those thoughts often. They might avoid things related to the event, whether it's going to the doctors, sometimes even their own babies, going to the NICU if the NICU is seen as traumatic, having a numbing, a sense of numbing, or they're hyper aroused and constantly on guard, physical sensations where they feel like their body is constantly almost like an engine. It doesn't turn off. Their brain doesn't turn off. They feel constantly on guard. Or they might feel outside of their body. They're dissociating where they just don't feel connected to their body or to themselves. They feel like things are happening to them and around them, but they're not a part of it. Next. Some other things to look at: postpartum OCD, which can kind of be an offshoot from anxiety, but we can see obsessions, intrusive thoughts. They might be more persistent or repetitive thoughts about things happening to the baby or to somebody in their family. Compulsion. So obsessions is where the thoughts are constantly there and won't turn off. The compulsions are what we think of when we think of somebody checking the lights or checking the stove or the door, right? So that's where mom might do things over and over again to help reduce her fears and obsessions. So checking the baby while baby's sleeping because they're afraid baby might die of SIDS. washing their hands because of fear of germs, a sense of horror about those obsessions. Many times they're so horrified about the thoughts of something happening to their baby, but are afraid to talk about it. They may fear being left alone with their infant. Usually there's a hypervigilance about protecting their infant, and kind of feeling sometimes worry about letting other people help with the baby or holding the baby even. Sometimes the thoughts can be very bizarre or overwhelming, thoughts that somehow they would harm their baby. And again, moms are usually quite upset about those thoughts. They don't want to cause harm, but they don't know why the thoughts are in their head. And so we have to kind of sometimes work through that. Next. So a few other things. Perinatal onset bipolar. 50% of women with bipolar disorder can be diagnosed during the postpartum period. That lack of sleep can often be a huge trigger for symptoms of bipolar. Increased risk for women already diagnosed due to them going off medications. Many times doctors are very anxious about pregnant women and breastfeeding women being on medications, so they will have them stop medications, which can be not a great number. So that's 50% of women who are diagnosed with bipolar. So of all women diagnosed, it is that postpartum period. Yes, Kara. So it may be mistaken for depression initially because mom might be coming in her depressed state where she's feeling very low, and the depression symptoms are kind of what we see. When she's feeling good and she's not needing sleep and she's kind of got lots of energy and might be painting rooms and redoing things, she's not as apt to come in sometimes. So that's where it can be tricky sometimes with diagnosis. And honestly, mania can be triggered by antidepressant use. So this is where working with a team to make sure that we're utilizing medications that can be very helpful, but sometimes medications can also trigger things. Postpartum psychosis, it is a much smaller number. 1 to 2 out of 1,000 new moms can experience postpartum psychosis. And, you know, I think we hear about some scary cases with postpartum psychosis, and it can be very tricky to diagnose. And it can look very scary when we see somebody who is maybe having hallucinations or is paranoid, super agitated, not sleeping. It usually develops in the first 2 to 3 weeks postpartum. However, it can develop later in the first year postpartum. It is a psychiatric emergency. Many times moms will need to be in the hospital to get stabilized with medications and sleep, and to help get the family acclimated to what needs to happen once mom does discharge home, and how do we help keep mom and the baby safe. And just because mom has postpartum psychosis doesn't mean she won't get better. It can take a team effort and a lot of work to kind of work through that, but we can get mom feeling better. Next. Suicide is the leading cause of death in the postpartum period. That almost needs its own slide. There's a lot of discussion about the adverse events that occur for women in pregnancy and the postpartum period. And it is important to realize that depression and that's untreated, bipolar untreated, psychosis untreated can lead to mom having suicidal thoughts and acting on those thoughts. So that is treatable. PMADs are treatable. It's part of the reason I love what I do, because I know that we can get moms feeling better. I know that they're struggling, but I know that with the right things in place, that we can get moms feeling better and people will be okay. There are good screenings for depression and anxiety. A lot of states have enacted legislation in place so that moms are having screening during pregnancy at least once or twice, and then postpartum with their OBs or with their pediatricians. There are a lot of moms for many reasons who are afraid to fill those out accurately. And so it is important for your doctor, if you feel comfortable, to talk about what you're feeling and how you're feeling, because those screens can feel scary sometimes, because women often think if I tell people how I'm feeling, that automatically means they're going to take my babies or they're going to put me in the hospital. And that is not the case. We want to make sure you get the support you need. And like I said, we can get you feeling better. So the next one. So there are a lot of different options for treatment. Individual therapy with a therapist who understands PMADs, psychoeducation, so that mom and partners and family can understand what perinatal mood and anxiety disorders are and how to best get you feeling better. There's different types of therapies, such as cognitive behavioral therapy, ACT, interpersonal therapy. There's a few different types of therapies that can be particularly helpful. Helping develop a support system. Moms who have supports do better. Those supports could be family, they could be a church, or religious organization that they maybe belong to, their own family or their own neighborhood units, other moms. And so trying to help come up with that is important. Medication is not always bad during pregnancy or with breastfeeding. There can be many medications that can be used safely. Group therapy, support groups, inpatient stays sometimes are needed. Intensive outpatient, there's couples therapies, there's different complementary and alternative medicines that sometimes can be used. Massage, Reiki, yoga, those can be great alternatives to helping reestablish mom to feeling a little bit back to herself once she's cleared, obviously medically, and just in general self-care, sleep, making sure mom's eating, taking care of herself with showers and drinking enough fluids, those types of things. Next. Medications, a little bit more with that. They can be a big help for some moms, and along with therapy might be what we have to do to kind of get mom feeling better again, or to reset her system, or to calm her system down so that we can get her feeling better again. Finding a provider who's familiar with perinatal mood and anxiety disorders and using medication is important. Postpartum Support International has a consult line. So if you are working with a psychiatrist who's like, I don't know what to do with this, having them reach out, it is free for them to call Postpartum Support International and to speak with a specialist who can work with medications. There's a couple different resources such as LactMed database, the mothertobaby.org, infantrisk.com. Those are some other places. But I always encourage moms to, I don't even tend to give these resources so much as to say, hey, talk to your lactation consultant. They can help you understand what medications might be safe along with your OB, psychiatric provider, and the pediatrician. So I think using that team and having them work together with you is going to be very important. Next, some other supports for moms. Postpartum Support International is a great resource. They have all kinds of support groups that are all virtual. They have a warm line that you can call, or a hotline you can call. They have all kinds of resources online. If you are looking for support in your state for therapy, if you go to their state, if you just go to postpartum.net, your state can pull up and you can find the person to reach out to for your state who could help you find resources in your state. And then there's obviously the National Suicide Prevention Hotline. I know that there are online through Facebook, different supports as well. And so those can be really helpful for moms to use. Next, I think that's it. Yes. So any questions?
So we did have one question in the chat from Rayanne, and it actually echoes a question I was going to ask you. She asked what, let's see, there's a couple, she's a couple, but one was, what advice would you give to someone who still struggles with health anxiety after traumatic labor and delivery years later? Is a common one.
Yeah. I think being able to get in and talk through it with a therapist who can kind of help you sort through the trauma of what you experienced is going to be very important. I kind of say therapy is like taking, all the papers that we get on our countertop, taking all those pile papers in and being able to sort through them and looking through them. Some things we can throw out, we don't have to worry about. Some things we can put away till later. Some things we need to look at right now, right? And so if our health anxiety from previous health issues is kind of keeping us from going to our doctor's appointments, going to the dentist, taking our own kids to the doctor because of our fear. We need to work through that now and kind of understand. Sometimes, there are different types of therapies that can sometimes be useful. EMDR is one that potentially could be useful. But I really think that just being able to talk through and sort through what happened, can take away some of the power of the thoughts in our head, and so that we can sort those. So, yeah.
Yeah, I think our members who have questions kind of like Rayanne's are often, they feel like they feel a loss of autonomy from their experience, whatever that was.
Yeah.
And perhaps they felt like they weren't listened to, like maybe they had symptoms that showed up before and they were dismissed. And then, whether they were connected or not is a different story, but they ended up in this situation. And I find that their concern is, my doctor's just telling me I have a mental health challenge and that there's not anything wrong with me, but I feel like I have a health problem. And we like to challenge that and say mental health is a health issue. And, kind of talk through, have you been checked for all these other things? Have, you're still having symptoms, but your doctor's done these tests, or you could ask for these additional tests. Like, what other advice may you give somebody who feels like maybe they're being pushed into mental health support, but they feel like they still have a physical, lingering health issue that is being brushed off?
So as a health psychologist, that is always one of the first things I do is say, when was the last time that you had blood work, that you did have anything done with your doctor and checked in, just to make sure medically things are looking okay, right? And then I do talk about that sometimes, especially with anxiety, we can hold on to, anxiety can mimic and some of those symptoms that we experienced during our pregnancy that felt off. And sometimes being able to talk through that sense of not feeling listened to, but also talking about what they did do well as a new mom. Did you get the support you needed? Did you talk to your doctors? Have you gotten help? And have you come to therapy? Have you been reaching out and advocating for yourself? And I think that is the biggest thing so many of us who've experienced this end up learning, is that we need to and can advocate for ourselves. And it can be frustrating to get that pushback sometimes from doctors. But I think also letting the doctors know, yes, I am talking to somebody about my mental health stuff, and making sure that that is in check, but I still feel that. And so I try not to minimize, because I remember my own experience, and it is very frustrating. My preeclampsia and health deliveries were 24 and 20 years ago, and this many years later, in the work I do, the stories are so similar, and it's frustrating, because I also remind parents that medicine is not an exact science. Yes, we can do blood work that can give us information. Yes, we can do scans that can give us information, but not everything is an exact science. And so trying to also normalize that the doctors have a lot of information and can help us go through the checklist, but it's sometimes, things can get missed, or the way our preeclampsia and HELLP syndrome presented could look a little different than what the checklist looks like. So it's just a matter of continuing to advocate.
Yeah, I think it's important that those two things can happen simultaneously. You can seek mental health support, and you can continue advocating for other physical health concerns that you might have. Dr. McElrath has a question.
Yes.
Yeah, I actually had kind of a question and a comment. I'll see patients frequently who have a pre-existing mental health diagnosis, and they're on a medication, and they'll be concerned about taking this medication during pregnancy, which is understandable.
Yes.
And one of the things that I think it's important to point out is frequently having whatever condition that diagnosis prompted, whether it's depression or bipolar, untreated depression is also a risk for pregnancy.
Yes, it is.
Associated with preterm delivery, it's associated with poor growth, fetal growth. And the same might be said for bipolar disorder. So a lot of times, adding the medication, even though none of us we'd all prefer not to be taking
Right.
medication in pregnancy, but sometimes it's really the safer way to go.
And the thing I say with that with patients too is because I would say if you had to take high blood pressure medicine, which many of us do, we wouldn't question that the same way we do the mental health medications. Women push back on those a little bit harder than they do on any of the medical diagnosis medications that we have to take. And so I try to remind them, like, our mental health is a medical concern during pregnancy and can trigger some of the medical concerns we're struggling with. So yes, I agree with you 100% that untreated is not better.
Yeah.
Yeah.
My other comment was if you could
Mhm.
say a few words about the NICU experience, because I feel a lot of times patients leave,
Yeah.
you know, they have to grapple with their own obstetrical experience, and now they're having this whole other dimension, which is very taxing.
So 50% of moms and dads who have had a baby in the NICU will have some type of postpartum depression, anxiety, PTSD. It is just a fact that many of our families do. This is why it's so important for NICUs and hospitals to have supports and resources. Being able to start talking about it right there in the NICU is incredibly helpful. But yes, I think normalizing that it is a traumatic experience, because many times parents come in there and they've never even heard of a NICU, and all of a sudden they're thrown into this whole new world that is nothing that they could have imagined. Trying to encourage them to lean on their nurses. I always say your NICU nurses are your interpreters for everything NICU, and they can be big supports, and just kind of normalizing for mom and dad to talk to each other, or mom and whoever their supports are, right? The partners together need to be talking about things, because I think many times we will see the non-birthing partner a little bit quieter and not feeling like they can share because it's not them that quote unquote went through the physical delivery. And so I really do try to encourage that communication with each other. And I just talk about what those symptoms can look like. And yes, having the support and trying to connect with other NICU parents can be very helpful, especially NICU parents that have kind of been through it and on the other side of the NICU can be very helpful. We could do a whole presentation just on the NICU piece. Yes.
Yeah, the University of Iowa has a fantastic NICU parent support group, and I know a lot of hospitals do. It really is critical in their long-term health. Any other questions? No? Thank you so much for covering all of the bases.
Very basic, but yes.
Yeah, no, it's fantastic. And I think it's, good for our members to hear it, especially from like a lovely, calming professional voice that you have with your experience, for them to, know that their mental health is as important as any other sort of physical aspect of their health, and that seeking that support doesn't mean you have to stop seeking it's medical care for your other ailments, but it's just as important. Just somebody said, I think Maggie said earlier in the day, that having a healthy mom is the best way to have a healthy baby, and that includes, as you mentioned, mental health, and that includes after the baby is born, right? Healthy mom, mentally, physically, is best for that baby as well. So thank you, Mark, for popping in the chat here. Oh, very good. Thank you for answering. Great, fantastic. All right, thank you so much, Brenda. I really appreciate your time. We are going to we're a little late for our break, but it was totally worth the time. No, not your fault at all. The discussion was fantastic. And I'm the next speaker, and I don't need a full hour. So that works perfectly well. So we're going to take a break, and we'll come back at 3:15 Eastern time. Okay. All right.